Ever been hit by a wave of panic after hearing that your favorite food might be detrimental to your health? Welcome to the intriguing world of health scares, where everyday items can suddenly morph into potential threats. This is a universe where fact and fear often entwine, where risks may not be as menacing as they seem. Health scares, these perceived dangers that capture headlines and flood our social media feeds, have a profound impact on our behaviors and beliefs. They can prompt us to scrutinize our diets, reevaluate our technology use, and even question the air we breathe. Yet how much of this fear is founded in reality? What stirs up these health scares, and how do they evolve over time? Are we just pawns in a game of mass panic, or can we discern the actual risks amidst the chaos? Buckle up as we're about to delve deeper into this captivating world of health scares. So, what exactly are these health scares that often grab headlines? Well, in a nutshell, health scares are potential threats to our well-being that gain a lot of media attention, often leading to widespread public anxiety and sometimes even panic. These health scares cover a broad spectrum. They can range from concerns about food safety to fears about technological hazards. And interestingly, they often turn out to be less harmful than they were initially made out to be. But despite this, they can have a significant influence on our behavior, from altering our dietary choices to changing how we interact with technology. Now let's delve a little deeper and explore the different types of health scares. First up, we have environmental scares. These involve contaminants that we might encounter in our surroundings, like pollution or pesticides. These threats can lurk in the air we breathe, the water we drink, or even the soil where our food grows. And while they might not always pose a direct threat, their potential harm can indeed cause worry. Next, we have food-related scares. These can involve anything from additives in our food to contamination during production or distribution. For instance, you may have heard about scares involving artificial sweeteners or genetically modified organisms. Such fears often drive us to alter our diets, sometimes drastically. Lastly, we have medical and technological scares. These are perhaps some of the most talked about types of health scares. They include fears about vaccines or mobile technology. You've probably heard about the purported links between mobile phones and brain cancer, or the unfounded fears around vaccines and autism. These scares can significantly impact public health, as they can lead to hesitancy in adopting beneficial technologies or medical practices. Now that we know what health scares are and the different forms they can take, we can start to understand their broader impact. They're not just about the immediate fear they instill, but also about how they shape our behavior, our choices, and our interactions with the world around us. Now that we know what health scares are, let's look at some real-life examples. Health scares are not just theoretical concepts, they have tangible, real-world implications. Let's delve into two salient examples of health scares that have shaped public behavior and had real-world consequences. First, let's talk about the COVID-19 pandemic, a health crisis that rocked the globe. Amidst the struggle to understand and combat the virus, a health scare emerged: misinformation surrounding COVID-19 vaccines. The spread of false claims, such as vaccines altering DNA or being used to implant microchips, brewed a storm of skepticism and fear. This vaccine hesitancy had a real-world impact, hampering community health efforts and complicating pandemic response. It was a stark reminder of how health scares can influence public behavior, even when lives are at stake. Our second example takes us to the realm of technology. The rollout of 5G technology, a significant leap forward in communication, sparked an unfounded health scare. Fears circulated about 5G's potential to cause cancer or even spread COVID-19. Despite a lack of scientific evidence supporting these claims, the scare had real-world consequences. People vandalized 5G towers, and some even avoided using 5G-enabled devices. The fear surrounding this technological advancement was a vivid illustration of how health scares can drive public behavior, sometimes leading to destructive actions. Both these instances underscore the power of health scares. They can sow seeds of doubt, sway public opinion, and even lead to harmful actions. It's a clear demonstration of how the fear of potential health risks can alter behaviors and influence societal norms. And these aren't isolated incidents. Health scares fueled by misinformation and fear frequently emerge in various areas, from food safety to environmental hazards. In essence, health scares are more than just whispered warnings or sensational headlines. They can shape our world, influencing how we respond to health crises, interact with technology, and view scientific advancements. These examples show how health scares can affect our society, but how do these scares originate and spread? Next, let's delve into the mechanisms that fuel and disseminate health scares, and how we can equip ourselves to critically evaluate the information we encounter. Understanding the origins and spread of health scares is key to mitigating their impact. The genesis and propagation of health scares are like a three-legged stool, relying on media influence, psychological factors, and social dynamics. Let's start with media influence. In our 24/7 news cycle, sensational reporting can amplify fears. Media often focus on potential dangers, regardless of their scientific basis, leading to a skewed public perception. A recent study found that media outlets are more likely to cover health scares involving novel or controversial issues, even when the actual risk is low. This can create a distorted reality, where the threats feel omnipresent and imminent, even when they're not. Psychological factors also play a significant role. Our inherent anxiety can make us more susceptible to believing and spreading health scare stories. This is known as the availability heuristic, where we overestimate the likelihood of events that are easy to remember or imagine. For instance, after hearing about a health scare, we might start noticing related symptoms in ourselves, even if they're unrelated. Finally, social dynamics are essential in how health scares spread. In the age of social media, information, whether accurate or not, can disseminate rapidly. One tweet or Facebook post can reach millions in seconds, and before we know it, a small concern has ballooned into a global health scare. Our online networks can act like echo chambers, amplifying fears and reinforcing beliefs, regardless of their veracity. The interplay of these factors can turn an isolated incident into a widespread health scare. A food contamination case can lead to fear of an entire food group. A single study on the potential harm of a technology can spark worldwide anxiety. So we've seen how these scares originate and spread, but how do we combat them? Combating health scares requires critical thinking, source verification, and an understanding of psychological phenomena like the nocebo effect. It's crucial to understand not all information is created equal. While some health scares are based on legitimate concerns, others are fueled by misinformation, misinterpretation of the facts, or even the nocebo effect, the phenomenon in which negative expectations of the individual cause the proposed medical treatment or prevention to have a more effect than it otherwise would. So how do we differentiate between the two? It starts with understanding the origins and motivations behind the information. Consider the source. Is it a news outlet, a scientific journal, or a random post on social media? The credibility of the source often indicates the quality of the information. Be mindful that even trustworthy sources can sometimes get it wrong, especially in the early stages of a potential health when facts are still emerging or when the nocebo effect is influencing the narrative. Next, question the motivations. Who benefits from spreading this information? Is it to inform and protect the public? Or is there an underlying agenda? Be wary of information that seems designed to provoke fear or panic. Induce a nocebo effect rather than educate. But understanding where information comes from, why it's being shared, and it's influenced by psychological factors is only part of the battle. We also need to arm ourselves with scientific literacy. Science is a process, not a set of facts. As our knowledge evolves, so too will our understanding of potential health risks and how our mindset can influence our health outcomes. Remember that initial studies are just that, initial. They provide clues and directions for further research, but are not definitive proof. Educating the public about the scientific process, critical thinking, and the nocebo effect is essential for reducing the spread of misinformation. Understanding how scientific conclusions are drawn and how psychological factors can impact our health can help us evaluate the validity of health scare claims. Finally, remember that critical thinking is a skill that can be honed, and awareness of the nocebo effect is part of this. It involves questioning assumptions, weighing evidence, and making rational decisions. It's our best against unwarranted health scares. By promoting critical thinking, understanding, and knowledge of the nocebo effect, we can better navigate the world of health scares. And in doing so, we can make informed decisions about our health rather than being swayed by fear, misinformation, or our own negative expectations. In this digital age, small concerns can quickly escalate into global health scares. We've delved into the world of health scares, peeling back the layers of panic to reveal the facts beneath. From food safety to technological hazards, we've seen how these threats are often less harmful than they first appear. We've discussed the role of media influence, our own psychological predispositions, and the dynamics of our social networks in the spread of these health scares. Remember, sensational headlines may grab your attention, but digging deeper and verifying the sources can prevent undue panic. Critical thinking is our most potent weapon in this fight. Understanding the origins and motivations behind information, coupled with a solid grasp of the scientific process, can help us maintain a rational perspective. Stay informed and help combat health scares by sharing credible, scientifically backed information. Subscribe for more insights and tips on navigating health information and improving your media literacy skills.